Hi, my name is Bruno Silva. I'm one of the dentists at Brighton Implant Clinic. We're making a short video today just to show you the advantages of dental implant treatment. It may be something that you're considering, and we thought we'd make a small video just to show you how implants work and how they differ from conventional bridges or crowns. So the example that I'm going to be showing you today is a very common problem that patients come to see us with. This is essentially a missing tooth. As you can see, we've got basically a tooth missing here between two natural teeth, and essentially we've got three options usually for a missing tooth. The first option that we can consider is something removable, which is relatively simple and quite straightforward to make. It's like in the form of a denture. It can be used to basically replace that missing tooth. The main advantage with the denture is that it is something that's removable, so it can be sometimes a little bit uncomfortable and a bit annoying because it doesn't feel like a natural tooth, given that it's not actually fixed to the adjacent teeth or it's not fixed to the jawbone. So the second option that we have is something called a bridge, or a dental bridge, or a fixed bridge. So essentially what happens in a case like this, we need to consider that you need to have at least a good tooth in front and another tooth behind the space that needs to be restored. So if we look at this example, we've got a molar tooth and a premolar tooth adjacent to the space, and usually what your dentist will do is they would actually prepare the adjacent teeth for a crown or bridge preparation. So in a case like this, that preparation usually requires a uniform thickness of tooth material to be removed both on the tooth behind and the tooth in front. So if I take these little crowns off, this is essentially the preparation that's required when you're having a bridge made between two teeth. What happens in a laboratory, in a dental laboratory, a dental technician will then make a bridge that will span from this tooth to this tooth. Essentially, this tooth in the middle is not supported by anything apart from the fact that it's resting on this tooth and this tooth. The tooth behind is now essentially doing a little bit more work or taking more stress, and it's shared again with the tooth at the front. So the advantage of a dental bridge is that it feels like a natural tooth because it's supported by your natural teeth. It doesn't move during function like eating or speaking. Unfortunately, the disadvantage with having a bridge is that the preparation that's involved when making the bridge, so essentially the reduction of the tooth by your dentist, is essentially a destructive process. So when we're preparing a tooth for a crown, or a conventional crown or a bridge, we have to remove a uniform thickness of tooth material, and that tooth material is actually being placed there for a protective function. When we reduce teeth like this, we're essentially taking everything closer to the nerve of the tooth, which is actually at the core of the tooth. So unfortunately, there is a higher risk that you may need to have a root treatment, or even this could lead to tooth loss long term when we're preparing teeth for a bridge. Obviously, when you're having a bridge made, in some cases it is the only option that is available. The risks, advantages and disadvantages should be discussed clearly, and the patient should be completely aware of the pros and cons of having such a restoration. Right, so the third option is a dental implant. So looking at this model over here, we've got again the same scenario with the tooth missing in between two natural teeth. And unlike the bridge option, over here we're actually placing an implant in between these natural teeth. So the implant is placed, the procedure is usually done under local anesthetic. It's no more complex, if anything even simpler to do than a bridge preparation. The implant is placed actually into the jawbone, and it needs about a 3 to 4 month healing period. So during that time, the bone fuses with the implant surface, and the implant actually becomes embedded and integrated with the jawbone. After a period of about 3 to 4 months, you will return to the dentist, and the dentist will place what's called an abutment on the implant. This abutment will eventually be a supporting post for a replacement tooth. So the advantages of having a dental implant when compared to the other options is that A, it's fixed, it's very comfortable, And because it's actually attached to the jawbone, it actually feels like a natural tooth. And for me, the biggest advantage is that you're not interfering with the teeth both in front and behind. This is very important because even if an implant were to fail, we can remove this implant. These teeth are still untouched. So essentially they remain as healthy teeth, and that treatment obviously can be repeated, it can be attempted again. And given that the success rate with implants is very, very high, it would be very likely that an implant would work hopefully at the first attempt, if not at the second attempt. Another advantage of having an implant is because it's attached to the jawbone, it stimulates the jawbone like a natural tooth. If you were to leave a missing tooth space for a number of months or years, over time you will lose bone around that area. And over a long period of time, it may be more difficult to have an implant there in the future. With an implant in place, it actually stimulates the jawbone like a natural tooth does. So the bone around the implant is actually stimulated by pressure or stress of normal eating function.